Bloodletting, usually we're using in a more acute conditions such as acute infection, acute injury, damage on the skin on the surface. Bloodletting in Chinese medicine is actually been practiced for thousands of years, just as long as acupuncture and Chinese herbs. I know the idea of bloodletting, it sounds really scary, and I'm sure many of you will think of it as witchcraft or sorcery. It's not. There's a reason why it has been around for so many years, and then we still practice it with cautious and with under the guideline of OSHA and everything, and clean needle technique. However, let me explain a little bit how it works. I'll try to explain it as much as whatever that back up in scientific research. Bloodletting in Chinese medicine, we don't use it in every condition. Unlike acupuncture is used in more general condition, like almost everything. But bloodletting, usually we're using in a more acute conditions such as acute infection, acute injury, damage on the skin on the surface. Our body face challenges such as infection, inflammation. The viscosity of the blood actually increase. You can think of it that the blood gets stickier because it's filled with substance like inflammatory factor, platelet, or white cell. And that also increases the venous pressure in the vessel. So just the technique in bloodletting in TCM is not, poke you and then have the blood gushing out. It's most of the time what we use it is poke with lancet on the distal point, like our finger or our tip of the toe, just a few drops of blood. It's not like tons, not that we want to drain the blood. Only a few drops will do the work, because just by that few drops, you actually can reduce the venous pressure in that, and that reduce that inflammation at the same time. The venous pressure will decrease because the blood just let it out, even just a few drops, that can help. By reducing the venous pressure, the surface area is not going to have that much tension or stress. So then the healing cascade can start. So there are certain points that we will use, like for instance, depending on the meridian that was affected. When we practice bloodletting, we also follow the meridian theory, the acupoint theory. So we don't just pick any points or vein to poke and draw the blood out. It has to follow the meridian and the acupoints. So it's always going to be distal. Bloodletting technique in TCM, we don't stimulate or we don't poke where the inflammation is. It's more on the distal. So it's kind of like when there's a congestion on the road. So in this, I have to come back to the TCM theory. When there's inflammation, it creates a condition in Chinese medicine called heat toxin or blood heat. So imagine that when there's inflammation or blood heat or heat toxin, there's more water that flow in. So imagine our meridian is kind of like a riverbed. So more water, more substance, more waste, more garbage flood into that waterbed. It's going to flood. It's going to flood out. So it's going to create a condition flooding. You can think of it as just too much of waste in the meridian or in the vessel. So bloodletting is not directly stimulate or poke around where there's stagnation or congestion, but more like having an outlet so that the waste can go out. So that's why we always pick the distal point, like the finger and the toe or the ear apex. Instead of like if there's a inflammation on the shoulder, like acute tendonitis, and then poke it here and let the blood out here. No, we use the points that follow the meridian and then poke the acupoints with lancet, and that draw a few drops of blood, and that will do the trick. So like acute sprain or strain, acute bronchitis, acute sinusitis, fever, especially in young kids. Of course, this has to be practiced under the licensed practitioner because we know what we're doing. We sanitize and then we practice with clean needle technique. So I don't encourage everybody to do that at home because it can create more problem or infection. Condition like acute pain or acute inflammation will be good condition for bloodletting. If you like this video, please subscribe and follow me, and I'll see you soon.